Good afternoon, everyone. It's afternoon here in Washington, D.C. today, and we're here to talk about how do we support mental health in the healthcare workforce. This webinar is brought to you by the Dr. Lorna Breen Heroes Foundation, One Mind at Work, and us here at URAC in Washington, D.C. So before we get started, you all are pros at this. We've been doing webinars so long at this point. Want to ask you to introduce yourself in the chat box and tell us what organization you're with. You see people doing that. We know you come from all different types of organizations, so tell us where you are. We'll find out a little bit more about you in just a minute. If you have any technical issues, you can message Nick Davis. And throughout the webinar, we'll be sharing links from the One Mind at Work Foundation, the Dr. Lorna Breen Heroes Foundation, and URAC. So look for chats from some of my colleagues. Lauren Hammett is in there as well with Sarah Toll and Nick Davis, and they'll be chatting in links for you. So here's a little bit about what's happening today. First, we're going to do welcome introductions. I'm already into this. By the way, I'm Lisa Silverman. I'm your X-Line Education Specialist. Sometimes I forget to introduce myself in there. We'll do welcome and introductions, some more of those. We're going to talk about what the data show us about workforce mental health these days. We have a great discussion. You can see the discussion topics on the right-hand side there and ways you can be involved with each of these organizations. So for the discussion topics, we're going to talk about a little bit about like the big picture systems. We're going to talk about the big picture systems to improve mental health in the healthcare workforce. But we also have to address those little things that get in people's way. Is it your mouse not working? Is it that you have to use a different door? Things like that, that just sort of take that extra minute and extra bit of attention. We all have them. We need to talk about who's responsible for doing this work. And then we're actually going to hear about some of the tangible benefits to improving workforce mental health. By the way, we love questions throughout the webinar. I know all of these presenters, they're comfortable with me interrupting them, and we want to make sure to have great conversation that really speaks to what you're here for today. Can't promise we'll get to everything, but any questions we don't get to, we'll chat with you afterwards and we'll be in touch. So our presenters today, my direct colleague, Laura Wood, who is director of URAC's Marketing Communications and Mental Health at Work program. Stephanie Simmons, and Steph is the Chief Medical Officer with the Dr. Lorna Breen Heroes Foundation, and David Ballard, who's the Vice President of One Mind at Work. I have to say, I love working with all three of these people. So for me to get to do a webinar with them, I hope you'll find them as outstanding and fun, as informative as I do. So we're grounding our discussion today in our recently released issue paper on supporting mental health in the healthcare workforce. URAC published this paper right around May 1st or so, and we're going to chat in a link to that. There's also the QR code. Don't worry, we'll send out a link to it afterwards. But the themes that came out of this paper really align with our discussion today. So we know that workforce mental health in the healthcare workforce is not a new issue. As Stephanie says in the paper, it's been a pandemic before the rest of us use the word pandemic. And she also talks about how healthcare is different from other industries. It's sort of a mismatch about the amount of work there is to do and the hours in a day. And there's the emotional aspect of the work as well. We talk a little bit about how do you eat an elephant? Hope somebody's going to chime into the chat there. How do you eat an elephant? One bite at a time. So it's okay to start small. That elephant of this work is huge. Thank you, Anita. The work is huge and it's important. So we need to talk about starting small steps. We're also, David and Steph are going to talk about some of these long-term efforts that show measurable results. David's got some great data to prove to us, and talk about the importance of why this is now.
Hello, everyone. I'm really happy to be here today to talk to you about really the things that we learned and found out from our issue paper. And to start off, and you can hit the next slide, Lisa, to tell you a little bit about URAC. Now, my sneaking suspicion is that Most of you probably already know about URAC, but for those of you who don't, I'll say URAC was founded in 1990, and despite the fact that it feels like it was only 5 years ago, that was actually 35 years ago. So we've been around for 35 years as an independent third-party accreditor. We started off in healthcare, so that's why we came back to healthcare and really individuals who work in the healthcare workforce as we started thinking about the impact of mental health at work. But we also now do the workplace mental health at work accreditation, which I will talk about a little bit later. I will say to you that we're really proud of the partnerships we have, the given sort of examples on the right-hand side, but we're also really proud of the relationship that we have with the other folks on this call who, this really is a 1 + 1 + 1 = 5 or maybe even more situation. I'm really happy to work with these fine folks and really share with you the importance of workplace mental health, especially in the healthcare workforce. I'll also say that it's important that all we do is accreditation. So we don't offer a ton of services. We don't do consulting. We don't offer other kind of services, solutions. We believe that accreditation is one of the best ways to improve healthcare here, in not only in the United States, but around the world. And so I'm happy to share with you today the things that we learned when we talked to some of our other partners in this paper.
And there comes Steph, ready to talk to us about Dr. Lorna Breen Heroes Foundation.
Great. Thanks, Lisa. It's lovely to be with you all here this afternoon. And I want to start by telling a story. So this is a picture of Dr. Lorna Breen. And Lorna was an emergency medicine physician in New York City. She came back from vacation with her family to care for patients in the first days of the pandemic, worked 18-hour days, day after day, caring for her patients, but also for her team as the medical director of the emergency department. She became emotionally and physically exhausted, caught COVID herself, came back 24 hours after her fever broke, and eventually required a rest. So she had her first ever mental health care. And after her discharge, expressed to her family her fear that because she had received mental health care and because of the stigma of mental health care, both internal, external, and institutional stigma, that she would no longer be able to be licensed in her state, credentialed at her hospital, or lead her team. And we lost Lorna to suicide soon after. First, dozens, then hundreds, then thousands of healthcare workers reached out to her family to share their stories, that they too faced barriers to mental health care and also work environments that often worsened their exhaustion, physical, mental, and emotional exhaustion. And so the Dr. Lorna Breen Heroes Foundation was created with the vision of a world where seeking mental health is universally viewed as a sign of strength, and that also those work environments can be improved to support human thriving. Next slide, please. So the foundation really works in 3 ways. We work to advocate for health workers at the federal and state level, as well as at the institutional level. We do this primarily through education. We advance collaboration of organizations like those here on this webinar today through our All In Coalition, and individuals through our Ambassadors Program. And we accelerate solutions. So where there are evidence-based, evidence-informed solutions that can improve healthcare workforce environments, we help to promote the adoption of those solutions. Next slide, please. One of those solutions is to remove invasive and stigmatizing language on hospital credentialing, peer reference forms, and state licensing applications. So this is work that was underway before the pandemic in 2017, 2019, led by the Federation of State Medical Boards, by the Federation of State PHPs, and I know we have representatives from that organization here. But the adoption was slow. So in 2022, 17 states had adopted best practice guidelines for state licensing. This is for physicians, and very few had adopted best practice guidelines language for nursing, pharmacy, or dentistry. And so what we've done is created the Champions Challenge badge to serve as a standardized form of communication so that healthcare workers know that their state and their hospital will not be asking stigmatizing language around mental health care. What we say here is that you can ask about current impairment, but if you're wanting to keep patients safe and make sure that healthcare workers are able to practice safely, current impairment really should be the limit there for any reason and not a lifetime of diagnosis or treatment. Clinicians cite these questions as a key barrier to receiving care, and when they don't have information, they'll often assume the worst. So the next slide you'll see at the beginning in 2022, the left-hand map is what the country looked like for physician licensing. And today, in May of 2025, we have 37 state medical boards that meet those best practice criteria. And it is safer for over 1.4 million licensed and almost 300,000 credentialed health workers to receive mental health care.
Steph, when I saw those numbers on this slide this morning, I was like, that's really awesome. And now I'm like, well, my state of Maryland isn't there. What do I have to do? Like, where's the work? Because we can see so much work has been and it's being done, but there are also some states that have a lot of people that are still missing there. So we know that your work is ongoing. Steph, do you also just want to talk about credentialing and how it works with the URAC? And I know we've come to a conversation about this, but I'm going to let you lead it there about just what does it do for URAC requirements there?
Sure, absolutely. So I'm going to answer those questions in the order they were asked. So we still have remaining states that haven't addressed their state licensing. I know that some of those states have this work underway. So currently, there are states on this map that are not purple that are underway to address these changes for physicians, but also for all licensed health workers. If your state is not purple on this map, there is a toolkit on how to help make that change happen, and the ability to write your state medical board, nursing board, pharmacy board, dentistry board to help with that change as well. Hospitals, we've been able to verify about 1/10 of the hospitals in the country that have made this change. And there are many reasons why people haven't yet. The main reason is they don't understand why it's important because the change isn't that hard to make. Afterwards, there's sometimes a concern, once they've decided to make the change, there's a concern that it's going to get them in trouble, right? With some regulatory body, the Joint Commission, with URAC, right? With NCQA, with any sort of organization. And the fact of the matter is, no other organization has said you have to ask questions this way. And URAC has really been a leader in coming out and saying, listen, if you change these questions to ask about current impairment only, if you follow these rules that the Dr. Lorna Breen Heroes Foundation has put out, you're not going to be in trouble with us. In fact, we support this work. And so I just want to thank URAC and Laura and Sean for making that very clear together.
Yeah, and I'll just add, coming from the URAC side, you'll see that our website is currently being updated with a sort of stating that very clearly so that there isn't any other, that questions can be answered as they come up. So I want to second what Steph said and be very clear that URAC supports the work that the Dr. Lorna Breen Heroes Foundation is doing in this space.
So before David comes on, Steph, we're seeing some questions about individual states. And I've asked, I'm going to ask you and your team to take those sort of separately because we can't go through all 50-some states, even the ones, because they're probably all nuanced and they're all at different places. But look to hear from one of the members of the Dr. Lorna Breen Heroes Foundation at some point in there. So, and David, do you want to come on and talk about what you're seeing from One Mind at Work? And I'll go off camera and go on mute again.
Great. Thanks, Lisa. And it's great to see you and Laura and Steph and have an opportunity to do this webinar. One Mind is a nonprofit organization, and we're really working to transform mental health. And we have a variety of core programs that deliver solutions that are designed to address gaps in research, in care, in workplace initiatives, and in public perception. So everything we do is guided by the best science and by lived experience. So we fund groundbreaking research, we accelerate innovation in new and emerging companies, we take steps to enhance workforce well-being and mental health initiatives, and engage the public to try to reshape what's happening in the space of mental health. Can we go to the next slide, please? One Mind at Work is one of the core programs and an arm of One Mind. And what we do at One Mind at Work is take the science of workforce well-being and apply it in real-world organizational settings. So we're trying to drive impact on the mental health and well-being of people in organizations and business outcomes as well. So everything we do is designed to really enhance the results for the people and for organizations themselves. Can we go to the next slide? We have about 150 member and affiliate organizations that we work with across the globe. So we are global. One Mind at Work, we partner with these organizations as this diverse coalition of employers, all who are really committed to improving mental health in the workplace. And there are 4 pillars to the work that we do. The first one that you can see here is access to our science and content experts. So we do consultation, we provide guidance on how to build and implement effective workforce mental health strategies. The second is our educational offering. So we have an annual global forum that's invitation only for all of our members, as well as workshops and webinars and other types of events that are all based on good science, but are designed to be practical and applicable in the real world. So we focus a lot on sharing best practices, and often these events and activities include case examples from our member organizations. The third pillar is measurement, and One Mind's Mental Health at Work Index is a first of its kind standardized assessment of organizational level efforts to support workforce mental health. It's a tool that allows employers to measure what they're doing, to compare their results to benchmarks, and to identify priorities for areas for improvement that's going to help them get better results for their people and for their organization. And I'll highlight some of the key findings from our index in just a minute. But finally, our members, partners, and affiliates form this really strong community of leaders who are all committed to workforce mental health, and they're engaged in activities to improve those efforts. So we do a lot of collaboration, including industry-specific initiatives where One Mind at Work can bring our expertise and resources, but the real power lies in the shared learning and networking and support from the community as a whole. So I'll leave it at that. There's lots I could talk about, but I'll highlight some of the key things from the index in just a minute. I'll pull, there's some results from our recent annual report, but then also a couple of other focal reports that we've done. So I'm essentially going to give you a sense of the landscape that we found from this index. So we've got over 100 organizations have completed the index to date of all types, from very small nonprofits all the way up to big global multinationals with 300,000 plus employees and all over the world. In short, one of the biggest trends that we've seen is, I'll frame it in James Brown's words, that there's a lot of talking loud and saying nothing. That there's lots of commitment to workforce mental health. There are a lot of CEO pledges and people saying, yes, this is a priority. So there's a lot of espoused commitment and support, but not a lot of action and follow through happening. So what we found from our index results is 2/3 of senior leaders say they're committed to mental health in their organization, but only 1 in 4 organizations even has a strategy for mental health and for dealing with that. So they're not intentionally taking actions. And when you look at why this is important, the organizations that do have a formal strategy scored 54% higher in overall program maturity on the Mental Health at Work Index than those who didn't have a strategy. So simply having a framework and being intentional about it helped them address and take all of the steps across the board that are necessary to really have a positive impact on the well-being of the workers and on the business success as well. Can we go to the next slide, please? So like a lot of healthcare efforts and spending, most of the time and energy and money is being spent downstream. We're spending a lot of time cleaning up the mess and fixing problems after they've already occurred. So one of the other main findings that have come from the index is that upstream efforts to protect workers' mental health in the first place and to promote positive psychological well-being, these things are massively underutilized. About 2/3 of organizations don't even have a process in place to identify the issues that are posing a risk to people's mental health. And almost all of the effort, 80 to 90%, is being spent on benefits and resources to address problems and try to get individuals to change their behavior rather than addressing the underlying issues. And yes, you need to provide those supports, but you also need to get in front of it. So less than half are taking steps to improve the work environment, and only 35% are working to eliminate negative working conditions. Can we go to the next slide, please?
Yes, but I'm going to let you catch your breath for a second
Sure.
here, because when I think about these upstream efforts, it's sometimes even the little things in the workforce that we don't even think about. Sometimes, like, and I will give a very personal example here. Sometimes saying Happy Mother's Day seems very innocent. Um, it may not be. It may be innocent to 80% and applicable. And same with Father's Day, same with some of those other special days. But even just the recognition of, like, hey, may the day land gently for those of you who need it to, because we know there are plenty of people who either don't have a great relationship with a parent, lost a parent, infertility issues, those little things. So how do you both do the stuff that makes people happy, but also pause for what could be just a little bit more of a sensitive subject, even if it's not sensitive to you, it may be to some in your organization.
Yeah, it is a tough balance. And I think a big piece of it is listening to employees in your organization, making sure they have a voice, creating an environment that's characterized by psychological safety, where people can raise issues, they can point out problems, they can raise concerns, even if somebody slips up and does something without thinking and it elicits some negative responses like you were just describing. Um, Simply being able to raise that issue and concern and talk about it is an important one. So I think, as has been said in a number of our events, listen to your employees because they're the experts, and that'll help you shape what you're doing instead of being at the top and thinking you know best, or that there's this one size fits all solution that you can just apply and it's going to work for everybody.
Your next slide is up, David.
Oh, thanks. So, I mean, in general, what we see when we look at the results is there's a lot of stuff going on. There are a lot of benefits and programs and initiatives that are happening, but employers really have no idea what's working and what isn't. There's not a lot of measurement going on. Less than 4 in 10 organizations are actually measuring the impact of their programs, and only 2 in 10 are evaluating a full continuum of protecting workers' mental health, promoting well-being, and providing benefits and resources. So less than 2 out of 10 are doing that. So there's a ton of time, energy, and money being spent, but most employers, most organizations don't know if it's getting the desired results. Can we go to the next slide? One thing that we do see clearly is that good organizational mental health practices are linked not only to employee well-being, but they're also linked to good business results. So not only is it the right thing to do to support workers, but it's a smart business strategy as well. And organizations that are scoring at or above the target score for best practice on the Mental Health at Work Index report that nearly 9 out of 10 employees would recommend the organization as a good place to work. And we know if you want to attract and retain the very best workers and be an employer of choice, you need to create an environment where people have a positive experience in the workplace and would say, yeah, this is a good place to be. Can we go to the next slide, please? Some other key findings in our most recent annual report, which we'll post a link to here. This focused on leadership at all levels. And one thing we found is that support for workforce mental health is often stalling out at the top of an organization. So while the majority of senior leaders are supporting mental health, as I mentioned a minute ago, only 1 in 4 are setting expectations that their direct reports are going to do the same thing in their business units or their departments and hold them accountable for doing that very thing. So again, why is this important? Well, in the cases where senior leaders are doing more than just giving lip service to mental health, those organizations reported less than half the voluntary turnover of those where leadership support was lacking. And then I'll do one more slide and then we'll get to some of the discussion here. It's really important that support shows up at the manager and supervisor level. That's really where the rubber meets the road, but that's only happening in about 1/3 of organizations. Managers need to be soliciting input and feedback from their team members. They need to be tailoring the mental health efforts to the specific needs of their department and creating opportunities for people to participate in these initiatives and then reinforce and recognize those who are making contributions in that case. And again, why is this important? Well, 75% of organizations that had comprehensive manager support for mental health saw employee satisfaction ratings go up last year, which was more than double those that did not have manager support. So we're talking about voluntary turnover, employee satisfaction, employer reputation, and overall maturity of efforts that are going to support mental health in the workplace, all being tied directly to these kinds of efforts organizationally to support people's mental health and well-being.
And I'm going to ask Laura and Steph to come back on. Great discussion we're about to have here. Waiting for Laura to turn on her camera.
I'm trying.
There you
There we
go.
go.
I
Oh,
know. Never a
clickety,
dull
clickety,
moment.
click, click, click.
I'm going to go off, Laura. You are an excellent facilitator, and these guys are amazing. So I'm just going to go off, and you won't hear from me for a little while.
Okay, excellent. Thank you, Lisa, as always. And thanks to David and Stephanie for sort of laying the groundwork for this discussion. So the first question, and Lisa previewed these on an earlier slide. So let's start off really big picture, and let's say, like, what are the macro trends that we see that need, like, systems that need changing? So and Steph, you already talked about it a little bit, and David, you talked a little bit about the leap from C-suite to actual sort of like boots on the ground. So let's unpack that a little bit and talk about the systems and the macro level that we need to address and really to sort of make any inroads here.
It's a great question, Laura, and it's interesting when we think about mental health in the healthcare workplace, there are real barriers to access. There are also real predetermining factors that can and will need to be addressed to reduce risk. So there's the individual strategy. How do we support individuals, make sure they have resources, screening, access, et cetera? And then there is the systems-based approach. How do we change the workplace environment to align work demand and resources, and also to make sure that these very mission-driven workforce, right, have the opportunity to fulfill that mission in a way that they can thrive as opposed to feeling like they are thwarted.
I'd like to ask a really quick follow-up question that will kind of lead into the details or the micro section. But what you said was they're sort of like mission driven. So the organizations are mission driven, but I would submit that the individuals are mission driven too, which can sometimes confuse efforts, because if those folks who are always being caregivers are always being caregivers, then are there other systems or other things that we can address in that way for those really who are caring for the caregivers, and how does that show up?
So I'm going to shout out Michael Decker in the chat, who just said, do no harm needs to apply to ourselves as well. So thank you for that comment, Michael. And it's true. So people who choose to be healthcare workers, doctors, nurses, pharmacists, dentists, MAs, like anyone in healthcare, they often do that because they feel a real desire to use their talents to make a difference in the world. And they are hardworking. They are often perfectionist. They are self-reliant, and they also are willing to work really hard. You actually have a hard time getting a job in a healthcare setting if you don't have those characteristics. So they're very important characteristics to have. But those are all hammers on a tool belt, right? And if you're asked to do a different sort of task, sometimes the hammers aren't the right tool, like changing a light bulb, right? So, perfectionism doesn't work well, I have found, when raising teenagers. Just going to throw that out there. Self-reliance, not so great in a marriage necessarily, right? hardworking. Well, if you've learned to solve every problem by working harder at it, and you're continually being asked to work harder and harder and harder, it can be hard to set healthy boundaries. So, the toolkit that we develop as healthcare workers can sometimes backfire when it comes to taking care of ourselves.
Yeah,
So David, let me,
can I add on
yes,
something to that
yes.
just quickly? You know, Steph, you were talking about you know, the nature of people who go into healthcare, and I think it says a lot. And yes, it's not just mission-driven organizations. You have a lot of people who are in their jobs because it's a calling to them. It's something that's meaningful. They're making a difference in their community and in the lives of others. It's bigger than them, and you put them in an environment where it's high demands, high stress, but they're also highly engaged at the same time. And not because someone's forcing them to be, they're doing it because it's meaningful to them and they want to be engaged. So these are exactly the kind of people who are going to go above and beyond, regardless of the limitations of resources, regardless of whether it's at the expense of their own health and well-being and relationships and everything else, because it is so meaningful to them. It's not just a job and a paycheck. And I think that poses a real risk and contributes to the burnout problem in healthcare in huge ways. And you know, Laura, when you talked about what are the things that are playing into all of this, there's so many layers to it. I mean, there's everything from the big picture systems levels of, you know, health policy and the way healthcare is financed and reimbursed in the United States, and electronic health records, and, you know, good intentions, but outcomes that further separate you from patients and create administrative burden, and, you know, even more work that just snowballs. You got all of that. But then you have organizational level things as well in work design. And you talked, Steph, you mentioned like the sort of job demands and resources piece of it, that you have people working long hours with sometimes unpredictable scheduling. Workload is very heavy. You also have a high, you know, patient and family member facing interactions for a lot of people in healthcare. Research clearly shows those are exactly the kinds of things that create high stress environments that lead to problems with health and mental health more specifically, and burnout and relationship problems, and you name it.
So let's take that idea and go sort of one step lower or further down to like boots on the ground kind of situation. So we're talking a little bit about like systems and big picture ideas, but what about the things that are like day to day? And I know that Lisa, mentioned earlier, so your mouse is just really slow and it takes you longer to do everything, and then it just begins to pile on top of itself. So I will give another plug for our issue paper where we interviewed some organizations. A lot of y'all are hospitals and health systems. So we talked to your compatriots in that space, and like, what are some things that we have seen, y'all do see, that are small but make a big difference? It's sort of like these small differences that box above their weight in changing the way that people sort of interact with their workforce and how their mental health is affected by those things. And Steph, we could start with you.
Sure. I have a long list, but I'll only highlight two in the interest of collaborating on time here. So the Dr. Lorna Breen Heroes Foundation collaborated with the CDC and NIOSH to make the Impact Wellbeing Guide, which was 6 actionable steps that hospitals and health systems can take to improve the workplace environment for healthcare workers. I'm going to highlight 2 of those. The third we've already talked about is hospital credentialing reform. So positive organizational psychology would say, like, find out what's working and do more of that, right?
Mm-hmm.
And so that's really one thing that organizations can do, is understand what works for people and do more of that. Now, there's a trick to that, which is to find out what works well for people, you have to talk to them. So then the second area that I would really emphasize is really strong, coherent, bidirectional communication pathways within your organization. And David, when you were talking about the commitment to mental health sort of ending at the executive level, right? This is what it made me think of, is that there are so many streams of information within organizations that that live and unfortunately die on one level of the organization. And so building in multiple opportunities for that bidirectional communication is critical. And one example of that is a GROSS initiative. So GROSS stands for get rid of stupid stuff, right? And so a GROSS initiative then is learn what your organization, what the people working your organization think of as the stupid stuff. Those pebbles in your shoe, as Muhammad Ali said, right? Like, it's not the mountain ahead to climb that thwarts you, it's the pebble in your shoe. So what are those pebbles? How do you remove them?
Yeah, that's a great descriptive of it, and highlighting the communication piece is an important one. I mean, people are often frustrated with a lack of information, not being able to find what they need, feeling like they're not aware or in the loop with what's happening that might affect them, and then the upward piece, not having input or a say in decisions that are going to affect their day-to-day functioning on the job is a big one. The common things that I've seen, especially in healthcare settings, but in other environments too, the little pebbles. I think about it from the work design and environment category of the index. So this is, how is work organized and actually conducted in the organization? But another piece of that's interpersonal interactions. And in healthcare, I've seen a lot of cases where there's a big power differential sometimes between different roles and functions in healthcare environments, between physicians and nurses and non-clinical staff and et cetera, et cetera. And often that winds up in cases where there's discomfort or incivility. People feel like they're not treated fairly or not treated well. Those little snubs, those little negative interactions that might not be anything big or significant can take on significance and snowball over time. So I think there's that aspect. And then I think the frustrations with bureaucracy of things that is something that should take me 5 minutes to do, and it's now taking me half an hour and 3 follow-ups because of paperwork and bureaucracy. And then equipment and materials that are not in good working order, or that create hassles along the way that shouldn't be an issue. It shouldn't be a problem, but it just becomes one more trivial, superficial thing, especially when you're doing work that you think is important. Then having those things that you shouldn't even have to worry about make your work more difficult, more time consuming, and get in the way of the important thing, I think becomes even more frustrating at times.
This is interesting. You guys both sort of talked about like communications and making sure that there were sort of bi-directional communication. And David, you mentioned earlier, sort of like things stop sort of like midway at the top, which puts me in a mind to ask, like, whose responsibility are these things? Who does what, when, to whom, with whom? Like, how would an organization set this up in a way that does all those things that we're talking about? Because, it's not just about benefits. So we can't say like, well, that's HR's problem, right? There's a whole panoply of parts of the organization that need to be involved. So let's talk a little bit about sort of what that looks like. David, if you want to give us a start.
Yeah, my short answer is everybody's responsibility in the workplace. Where we see it done best, there's a cross-functional team that is assembled that's in all of the relevant parts. And every organization looks a little different, but typically it's somebody in executive leadership, it's somebody in health and safety, it's somebody in HR, it's somebody in benefits, somebody in communications, somebody in training and development. It's all of the areas that touch up against the kinds of things you do to support people's well-being in the workplace. So the places that do it well have a cross-functional team. They get the right people around the table. They figure out who those right people are. They assemble them. They collectively do the work of creating strategy, figuring out implementation, and are responsible. But they also seek input and feedback from all of the other relevant roles and stakeholders in the organization. And then I think there's also an upward communication piece, or an upward role, where the corresponding piece that we often see in places where this works really well is there's some sort of grassroots involvement, and whether that's an employee resource group, an ERG, or whether that is a champions network or ambassadors network of people who they get extra training. They're the representative in their particular unit or within their function of the organization. So they become a conduit. And when all of this is done collectively and co-owned, that you create a strategy and a plan that truly meets the needs of all the stakeholders, because you got the input coming in. It's tailored, so it's a good fit. and people feel like they had a voice in shaping it. So it's co-created. It's not something that someone in HR or in leadership decided, well, here's what we're doing, and then we have to try to get your buy-in. You don't have to get their buy-in if they were part of creating it and they can see themselves in it and had an opportunity to contribute.
Steph,
when,
what you want to add?
absolutely. So when we speak to healthcare leaders and frontline healthcare workers, everyone is frustrated with the situation. Healthcare leaders have a lot of efforts often underway to improve the workplace environment, and don't think that healthcare workers understand or appreciate that. And healthcare workers feel like they're not being listened to and that their environment is unresponsive to them. So there's a little bit of this going on. And additionally, when we ask healthcare workers and healthcare leaders who has the power to make change, no one feels solely empowered to make this change, and everyone recognizes that it's going to take the full system working together. And they're right. So it is critical that partnerships that are interprofessional, certainly across organizations, but also in addition to having great breadth across the organizations, really incorporate the voices of frontline workers, team leaders, executive leaders to understand. And then frankly, there has to be action on the feedback that's given.
Yeah, that's a huge gap. I mean, a lot of times, even if you're asking and you're conducting surveys and focus groups and you have open door policies and other feedback mechanisms, a lot of time that feedback disappears in a black hole and nobody sees anything ever happen. Why would you give feedback or be involved and expend the energy next time if you did it this time and nothing happened as a result of it?
You know, I have a 10-year-old, and I usually ask her, what do you want for dinner? And the other day she goes, why are you even asking? You're just going to make me what you want anyway. I was like, you know what? You're absolutely right. A, and B, that's not the way healthcare organizations should work, right? So we need to not ask if we're not going to act on what we're asking about. And if it's not actionable, if no change can be made, the why and the when and the what needs to be communicated on that as well.
Yeah, you can't always do everything in response to it, but conveying that, we heard you, here's what we heard, and here's what we can do about it, and how it's going to impact you, and what your role in all this can be. That carries a lot of weight, even if you can't necessarily make the changes that people would want.
Mm-hmm.
I'm actually going to veer a little bit. We got a really good question that came in, and so we were talking about the getting rid of stupid stuff. And one of the folks on the chat says, "Growth seems to be such an impactful approach, but I find it's relatively unknown or seen as impractical. Can any of us speak to some of the barriers that we've seen and what it looks like when it succeeds?" And I will say again, I will give another plug for the paper because we actually do tell some of these stories in the paper. So Steph and David can talk about them, but if you want to read them, as well as in general, some of the successes and tangible benefits that come from undertaking this work, all of that is there. But I really wanted to address this question because I love it when we have an active chat.
Mm-hmm.
It's active enough that Michael's nodding and he's not even on camera.
I love it. Growth initiatives go by many different names. And what we're finding is that the most effective implementations of growth initiatives meld administrative processes, technology, and just human technology as well. So there needs to be a certain degree of trust for a growth initiative to work. Frontline workers need to trust that the information they're sharing will go somewhere, that something will happen with it. And healthcare leaders and implementers need to trust that the data that they're giving, the information that they're getting is real, right? These are things that when changed will make a demonstrable difference in the day of the workforce. And so that's the human factor component of this, is you need that trust. We are seeing some technical ways that can accelerate gross programs, including utilizing the event reporting system to gather data from across the healthcare system, so that it's a way to sort of identify those pebbles, and then integrating that with an administrative process, right? With a regular meeting of managers, implementers to respond to and close the loop on that feedback. So you need that closed loop communication, trust, and then also the mechanism, the way to get the feedback. And the AMA actually has a great resource for how to do this as well. So I encourage you to look at those resources.
Yeah, so, some of the most frustrating, stupid stuff that I've seen and heard about in healthcare and other organizations has to do with bureaucratic processes that have way too many steps that are unnecessary, that convey a lack of trust. And often they're related to IT requests and processing financial kinds of things in an organization. So, a simple request that happens all the time that requires 3 layers of approval that is going to wind up taking a week and a half, when, the very next person in line could have signed off on that easily in a few minutes. That's the kind of thing that it wastes people's time and it slows down and bottlenecks everything. It happens all the time. So where I see that addressed well and getting rid of that is evaluating those processes that are not effective, that are creating problems both operationally but also impacting people negatively in terms of their ability to do their job and their own well-being. But it's often pushing decisions down and pushing the ability to take action down to the lowest level that is reasonable within an organization, so that something doesn't need to go to a director of a department for a basic routine level approval of something. So evaluating those and making changes to the way you're doing work. I mean, that's a great job or work redesign kind of issue, that here's a regular recurring problem that you could make a simple change that would make people's lives so much better like that.
That's great. So, Lisa, I think we can move on to a little bit of closing. By the way, I could sit here and do this for hours. I don't know about the rest of y'all. I feel like the chat is pretty into it, and we may have to have a part 2 of this sometime soon. But I really enjoy working with these 2 folks, and I could do this for a long time. So if there's anything we haven't covered, you can let us know in the poll afterwards, and perhaps we'll spin up a part 2 of this. So a lot of people I saw out of the corner of my eye in chat were asking about the accreditation. So lucky for you, I have a couple of slides to talk about it. And so if you go to the next one, Lisa, we'll talk sort of generally about it. And then I am the person that you can contact with any further questions. So, if we talk about very quickly, it is sort of recognizing the work that organizations do. Now, David talked about the Mental Health at Work Index, and I will say that we worked with the fine folks at One Mind at Work and developing our accreditation based on the same 10. So if you were to look at their 10 areas, our 10 areas on the right side of this slide are the same. And we've touched on most of these organically during our discussion, sort of what the level of leadership needs to be, what a communication plan looks like, how a mental health strategy needs to underpin all of it, work design, which we were just talking about in the growth initiatives, right? And so I want to point out one significant difference between the index and the accreditation, and that is that the accreditation is built to recognize organizations in an outward-facing way. So we ourselves have done the index. It's helped guide us into some work that we needed to do to meet some short sides that we had. And the difference then is that the accreditation allows organizations to talk to their partners, to talk to their clients, to talk internally to their own staff, and even when they're doing recruiting and retention activities, to show that we're committed enough to this set of activities that we want to talk about it. So the URAC accreditation seal in this case is not just like a seal and a box checking exercise, but rather shows an organization's commitment to improving the mental health of their workforce. And more, when people are choosing, say, between 2 essentially equivalent positions, an organization that is prioritizing the mental health of its staff very much has a leg up when it comes to recruiting and retention. So I am happy to say that, as we work through this, this accreditation program. I'm delighted to speak with anybody who is interested in learning more about it, just a general conversation. There's a few slides later where you have contact information for all of the organizations that have spoken. And please do let me know if you have questions about the accreditation. I can't see the chat because there's too many windows open right now, but Lisa, if there are any questions that I can answer right now, I'm happy to do that too.
Laura, I have been encouraging people to answer this poll that I'm pulling up right now for you to tell us which organization of these three, if you would like to hear from any of us, and if so, when. I have the poll pulled up. I'm not going to share it. Hopefully you all can. Okay, good. I got a couple of people responding there. It's always a little scary at first when you're like, is anybody showing this? So, but you can let us know, do you want to hear from us right now? Do you want to hear from us in 6 months? So we're getting that for all three organizations. I'm going to leave this up for a minute. I can't move on to the next slide. But David and Steph, while I have this up, I'm going to ask you both to come back on camera real quick because I have like a spare minute here that I've allotted. And Laura, you too. David, I'll start with you, then Steph, then Laura. Where do you want to see this in 5 years? Where do you want to see workforce mental health for healthcare in 5 years?
Yeah, I'm trying to keep this realistic because
Yeah.
I've watched the
Yeah.
health and well-being space in organizations for more than 2 decades and seen the relatively slow progress. So in general, I would like to see the mental health space move more quickly towards adoption of best practices than the general health and well-being space has. So I'd like to see more organizations with a concrete strategy to address these issues and to be measuring what they're doing so they can make smart decisions based on data and get results from that.
Awesome. Steph, your vision, what do you want in 5 years?
I would like to see a health system where healthcare workers' rights to receive mental health care and physical health care for their own well-being are recognized. And also that there is a recognition across the healthcare milieu that professional well-being and mental health for the healthcare workforce is a critical workforce component, that we will not have a healthy, thriving workforce and healthcare infrastructure without this recognition.
Absolutely. Laura, you're up.
Yeah, and I would say that mine is sort of probably a melding of the two. I think, I've heard so often, I'm not a clinician. I've heard so often that, clinician mental health is actually lagging behind the general public, like the way that we talk about it and how we address it. And so my fervent hope is that 5 years from now, it will at least have caught up and maybe even surpassed the comfort, the lack of stigma that we have, the support that we have for healthcare workers of all kinds and all licensures doing all kinds of jobs to really support them as they care for us every day.
Thank you all. We have had an exciting interactive chat box here. I could listen to David, Steph, and Laura chat about this all day. And I know there were several times where I asked if people's heads were nodding and they said yes. So thank you to everybody. There will be an evaluation that pops up when the webinar ends. Thank you for joining us today. We have contact info for the 3 organizations on the screen. We'll also include that in our follow-up messaging. Thanks, everyone. Enjoy your afternoon.
Thank you.